Good afternoon. I'm Bob Dempsey, Chair of Neurosurgery at the University of Wisconsin-Madison, and I wanted to do a COVID update at this time because I think now, June of 2022, we're all getting a little bit nervous. I'm getting nervous because although I've been hearing reports that things are much better, that there's much less ICU patients, for example, with COVID, decrease in hospitalizations, I'm still nervous because a lot of our staff, a lot of their families have gotten sick with COVID recently. Now, sick with COVID now seems to be different than it was 2 years ago when there was great concern about loss of life, but there remains concern about disruption in our lives and the possibility of long haul symptoms and the concerns for frail or immunocompromised people. These remain very important. So I thought that plus a lot of new information on the vaccines and this sort of almost silent surge we're undergoing this spring where things look good, but we still keep hearing far more than we did before, friends and associates turning positive, disrupting their lives. It has been a long time. We've been doing this uh, so long that we kind of forgot that our lives used to look like this, where we would get together as groups of people, no masks. Um, we'd eat, we'd celebrate graduations. And so June is a time of that, and I thought it was good to remember we are getting back, but normal is different. Normal will always be different because we've learned a lot about ourselves and about diseases. Most importantly, we've been dealing with a really devastating disorder. 600 million cases confirmed. Now, to stop and think about 500 million, that's a big number and it's tremendously underreported because that's just things we confirmed. Most of the world doesn't do the testing that we do and never did. We know, for example, that in some African countries where we've just said, okay, we know they didn't give many vaccines. Let's see how many people have positive antibodies. It's like 60% of the population, meaning there were a lot of people who were sick and a lot of people who died, and it wasn't really total that way. Nevertheless, 6 million are confirmed. In the US, 1 million. That's a huge number. Compare it to auto accidents, to gunshots, to anything. It's a huge number over the past 2 years. Wisconsin's been relatively spared. We know we underreport the numbers, but we do have data, and we have far more data than we ever did before, ways to test and ways to look at what's going on. One of the important things we learn is that the distribution of this pandemic, now entering well into its third year, is both different geographically and by time of year. We've seen surges, which I think is quite reasonable because this really was coronavirus is one of the viruses of the common cold. Seasonal differences in respiratory viral illnesses are norm. And this is usually a better period for that. Remember, a year ago in June, we were quite cocky that we were getting past this pandemic, beginning to open up, and then another variant took place. The other thing is the geographic distribution, which you can see is relatively better than it used to be, but there are some significant hotspots of populations or perhaps disbelief about vaccinations that still persist. Most importantly is our own numbers. While we've seen nationally and internationally these cycles, and we're very pleased that we're in a down cycle, relative down cycle now for the known infections, we're nowhere near as good as we were last June. Here in Wisconsin, we still have far more cases than we did in March of this year, but we're hoping it's beginning to go down a bit. The deaths, however, have remained low. down at the 3 number. Hospital admissions are much lower by a factor of 4 or 5 times better than they were at the height of our problems, but we still have a significant number of people in the hospital with COVID. Mind you, the majority of those came in the hospital for another reason, and we found they were positive. Nevertheless, 61 in the ICUs is a pretty big number. Nothing like it was during the height of our problems. So the question is this ever going to go away? Or are we going to get used to it? Are we going to learn to live with it? And the answer is all of the above. So let's try to dissect that and see what that means. The reason that we're doing better right now is because the virus changed, because our treatments changed, our vaccinations remained good, and we developed some novel treatments for the sickest patients. These antivirals became more targeted to this disease. And so it's important to understand the virus changed. That's the first part. And it will always change. It's an RNA virus. Mutations are its rule. It's constantly changing. And many of those mutations are either worthless to the virus or fatal to the virus. So there are changes, it didn't work, that goes away. Some, however, of a virus that's been around as a common cold forever might change to make it particularly easy to catch or infectious, and particularly dangerous or virulent. Well, that was the original novel, as it were, new virus of 2019, therefore the Corona 19 virus. And it really caused a tremendous upheaval because the death rate was quite high. It affected the healthcare providers. It devastated the elderly, as it usually did. It seemed to spare the very young. It caused tremendous shutdown of the world economy, our health systems, etc. But it continually mutates. And usually with these pandemics, even if you don't have modern medicine, you look historically, many of these rapidly mutating viruses would mutate to something that may be easy to catch but not very virulent, and that would replace the virulent type and would drift back among the other common cold type viruses. That would be fairly normal. But along came a huge surprise, the Delta variant. And remember, we've gone through a whole series of these variants, but the Delta one was both easier to catch and more virulent, and that really caused a problem. Fortunately, it was replaced by severals, which we now call the Omicron, which is very easy to catch, but not as virulent. Hence, it's beginning to drift back. So the virus did its part. How does this happen? Well, all these alpha, beta, gamma, delta mutate until they understood that they've got to stop using these Greek letters because they don't want to get to pi, which would be the next logical one. And they've not used different Greek letters because they might sound like people's names. But understand that even with an Omicron, there are various sub-mutants, none of which has become dominant enough for it to become the common lingo. This will continue. We simply hope it follows the regular rules of not becoming more virulent, because there isn't really a particular good reason for that to be preserved. Becoming more infectious and not devastating its host, that would be a good strategy for a virus that's mutating. The Omicron was the problem because it's still with us, it's still mutating, and it can reinfect. Okay, so that raises the question about just how effective is natural immunity to this if so many people have had it. And the answer is natural immunity from a previous infection is useful, but it is not complete. And there's some question how long it lasts. We know that because we try to duplicate that natural immunity without getting sick by vaccines. We've learned more about vaccines in the last 3 years than most of us ever cared to know. But what you need to know remains the same. One, there was a new type, the RNA type, of which Pfizer and Moderna are the common ones here in the US. They were remarkably effective, remarkably, 90+%. That's never happened before for a vaccine. Um, but the rest of the world didn't have access to it. They had access to more traditional vaccines, which were less effective but still helpful. The newer types were more effective, but all types helped. The problem is the duration of that benefit. It varies, and it varies tremendously. It's hard to pin down, but it's less than we hoped for. There's no doubt that these vaccines mitigate how sick you get or how often you get sick, but you do still run the possibility of being infected by this Omicron variant. And there's no question that it's better to be vaccinated, but doesn't last forever. The data we look at says that about 6 months, your antibodies begin to wane, and then you begin to think, should a booster be needed? The answer to that is always your particular health, antibodies, and the situation of the virus out there. Is there a lot of virus, a lot of people being infected? Because you see, the virus changed, but the vaccines up until now didn't. They can. It just takes a long time to make a vaccine to a particular variant. And if that variant keeps changing, it's a moving target. One of the most important things about treatments and vaccines is very, very shortly, we expect children over the age of 6 months of age to be available to be vaccinated. All of the work, which really has taken probably an extra year, well, I'd say an extra 6 months than was expected to check the safety and efficacy in small children, is now coming to fruition. And I predict that that will be available soon. And I strongly suspect that it will be a good idea because so many of the infections we've seen recently seem to have come through the unvaccinated children to the previously vaccinated adults who became infected. Boosters will be needed. The timing is not clear. I do think that as they begin to get an eye on what the variants are going to be, you're going to see the major companies developing more specific vaccines and probably targeting them for the time in the fall and winter when we see respiratory viruses. So it will be probably a booster combined with flu shots. That's always what we predict, and that's what I predict for this fall. So the other piece of the puzzle are the antivirals. We don't hear so much about them in our own society, but the hospital you do, because the antivirals are probably one of the ways we're keeping people from becoming very ICU sick. And there are methods to give these and criteria or protocols. They are relatively effective, but they're no cure. And it appears that they do knock down the severity of the illness. And the latest data suggests that you may not rebound when that medicine is completed. But I do think vaccines can be more specific. So where are we today? We have a very common but less virulent virus. It's very easy to catch at all ages. The early theory that young children were immune just doesn't hold up, at least to the newer variants. It's still dangerous in the elderly and the immunocompromised, and we need to protect each other. It will be capable of disrupting work, travel, life, and in some people making them quite sick. At this rate, it's beginning to look like some other viruses which we've been living with for a long time, some of which we have vaccines for, like the flu virus. But it is different. Worldwide, the response is many people, many countries are treating this as endemic. That is something they're going to live with. But realize that as you travel, if you turn positive, you may end up being isolated, you may have trouble returning. And so the question is going to be, how sick are people going to be able to tolerate. And it's a question you hope not to be answered on yourself, because a lot of the world is not taking precautions. So what do we know? The masks still work. Protect yourself. It's different than before when we were talking about protecting each other. Most people aren't wearing masks if you get outside of the hospital. So protect yourself, especially in poorly ventilated indoor areas. Outdoors seems to be much safer. Vaccines still work, but they don't work forever. So we're going to need boosters and we're going to need to protect children. The next logical question is going to be, when do we stop testing? Because you see, the numbers that we have now for number of total cases is totally wrong, because so many people get sick and don't get tested, or get home tested and don't report it into the large databases. The numbers we know are where we test, which is the hospital and the ICU. And we know that it's still surprising number of people who didn't know they were positive are positive, and we just have to cancel surgeries, etc. But still, with appropriate treatments, a nicely low number will end up in the ICU. So the death rates are falling. Where does it end up? Well, protect yourself. Use common sense. Our lives are changed forever, but some of it's good. We're more careful about each other. We can be more careful about each other. I mask indoors and I mask church, things like that, where large groups get together, not all of whom do mask. And I will for a while yet, till I see that the hospital isn't constantly seeing people with this disorder. We will be stronger from it, and that includes in every way. And hopefully we'll learn more about working together, because that's really what we have to learn from a pandemic, and how much we rely on each other. So, as always, I'm very proud of you. We are doing much better. We are indeed in a place where we can see a light at the end of the tunnel. We've been fooled before, but we have more tools now. And in the end, protect yourselves is all I can say. Wish you all the very best. Thank you now.